A very good morning to all of you, my dear friends. In continuation on our series in pediatric dental education, today we are going to discuss a very critical topic. What is the scope of pediatric dentistry? So, the most commonly asked question these days is that what is the scope of periodontics? Is there any scope for periodontics? Because see, the general trend all over is what that milk teeth, they're not important, they're going to fall. So what's there so much that is required? Why do we need to take good care of the children's teeth? I mean, what is the scope? I mean, are the periodontists having any work milk tooth there as it is going to fall? Who's going to come for treatment? And a variety of questions are being asked. So now in today's lecture, we're going to discuss the scope of periodontics. What all can a periodontist do? Now we're just revising the definitions again. What is pediatric dentistry as per Stewart 1982? He says that pediatric dentist as a practice and teaching of comprehensive, preventive, and therapeutic oral health care of children from birth to adolescence and is construed to include care for special children who demonstrate physical, mental, or emotional problems. So this definition itself gives us that there is a lot of scope. There's another definition which states that given by Pinkham. It is synonymous with dentistry for children, and dentistry exists because children have a dental and orofacial problems. The genesis of dentistry for children unquestionably allied to dental decay, pulpitis, inflammation and pain associated with infected pulp tissues and suppuration in alveolar bone. So here the focus they say that pediatric dentistry will be taking care of children's teeth. And then again, Boucher gave another definition. He said that it is that branch of dentistry that includes having a child accept dentistry. Yes. So here the stress on behavior management comes back. So child psychology and behavior management is an important aspect of pediatric dentistry because the child should accept dentistry first. If he doesn't open his mouth, where does the dentistry begin? So then there is prevention, detection, restoration of primary and permanent dentition, applying preventive measures for periodontal therapy, dental caries, prevalence, intercepting and correcting various areas of malocclusion. So here they have included orthodontics also, preventive and interceptive orthodontics. And the most accepted definition is by AAPD 1999. He says that pediatric dentistry is an age-defined specialty and provides both primary and comprehensive preventive and therapeutic oral health care for children, infants and children through adolescence, including those with special healthcare needs. So the definition is telling that there is a lot of scope. So now what is the scope? Now we have to understand that periodontics is just not an age-defined specialty. It's an age-defined specialty and not a technique or a disease-specific thing. And it encompasses all aspects of oral health care for children and adolescents and special kids with physical and emotional handicap. And then preventive measures is very critical. And periodontist also holds the privilege of being the first person to diagnose the earliest sign of systemic disorders. So many systemic disorders can be detected because the mouth is the mirror of the body, and he's the earliest. Now, this lovely diagram explains in detail. If guys you have doubts in your mind, where is the scope? Just check all the things that you can do when you're talking about pediatric dentistry. It includes restorative dentistry, oral medicine, dental radiology, cardiology, preventive dentistry, oral surgery, oral rehabilitation, dental materials, special care dentistry, immunology, neonatology, child psychology, preventive orthodontics, endodontics, periodontics, and allied health sciences. So the scope is tremendous. So now restorative dentistry, multiple caries. See, you'll never have a child who comes with a single caries tooth. There is a concept of early childhood caries. Children are facing a lots and lots of dental problems, and restorative dentistry is becoming more and more critical. You can just see. And now crowns, everything have come in, aesthetic cosmetic crowns have come in. And if you see, more and more parents and children have become very much aware. I mean, previously, if the front teeth were black, the child would not bother, the parent would not bother. But now there is a concern. Everybody wants to look good. So cosmetic dentistry comes in a big way for kids also. Even the kid has the right to look good. Then preventive dentistry, prevention is always better than cure. And pit and fissure sealants. Now, these are the special preventive fillings which are done especially for the molars. Okay, so and they play a very, very important role. Now, literature has suggested that the first permanent molar is a very, very critical tooth, and it stays the longest. Technically, it has the longest life in the oral cavity. I mean, it's the first permanent tooth to come in the oral cavity, and if taken care of, it has to stay till you are, like maybe 70, 80, 90. Yes, and this is a tooth which catches the cavity very, very quickly. Caries is because of its anatomy. So pit and fissure sealants is one major preventive treatment that really, really helps. Then oral medicine, radiology. Okay, radiology is very, very important, and plus detection of cyst tumors and other anomalies. Okay, now CBCT and all that stuff is very, very common. OPG. So, and plus, see, when you are in college, I mean, there is a special department that's oral medicine, and radiology takes care of the case history and the radiographs of the child. But when the child comes, they refer it directly to the Department of Pediatrics because they are making a radiograph for a child also is very difficult. So that's also another skill. Then you have oral surgery. Many people want to become an oral surgeon. Okay, but unfortunately, for various reasons, they are unable to do or get into oral surgery. So, as a periodontist, is there any oral surgical work? Lots of oral surgical work is there. Excision of cysts, tumors, and other anomalies. There is something called as a supernumerary tooth, mesiodens, and a variety of things that require surgical intervention. And the most favorite, and then full mouth rehabilitation. Okay, full mouth rehabilitation is very, very critical. It's just not about filling or removing teeth. It can be, even now children are wearing dentures. You have to make, removable partial dentures for children, crowns, everything comes. Special care dentistry. Now, with the, nowadays, a lot of kids with Down syndrome, cerebral palsy, autism, okay, epilepsy, all these are seen. Now, what do you do? I mean, they come with different age groups. Even if it's a 30-year-old kid who's mentally retarded, the periodontist has to manage. So special care dentistry, there are special care institutes in some countries in the world. Because who's going to take care of these kids? Everybody is shying away. It is very tough for these kids to maintain their oral hygiene also. Simple procedures like brushing the teeth is a nightmare for the parents. So in these situations, the role of pediatric dentist is very, very critical. And you as a periodontist are entitled to do their treatment, and you can really work hard and specialize in this area. The neonatology, cleft lip, cleft palate. Many of you have an oral surgical inclination. So cleft lip, cleft palate is one of the most amazing things that is available. And all newborns come with this. There is something called as nasoalveolar molding also. A variety of procedures related to cleft lip and cleft palates. If you are good at it, you can do that. Then preventive everything in cleft lip and cleft palate patient comes in the scope of periodontics. You as a periodontist know the eruption sequence, eruption schedules. You know so many things about the child. These kids also have a problem making feeding at times. So at birth also they might be brought to you. You might have to make special devices with the help of which are called as obturators, with the help of which the child can feed properly. Then there is something called as natal teeth and neonatal teeth. The teeth are present at birth. What will you do about it? They need to be extracted. So it's not an easy job. Then tongue tie, my dear friends, is one of the very, very common things that is occurring nowadays. And tongue tie causes a lot of feeding problems and various growth and development problems in children. So you as a periodontist are very well trained to take care of this. Breastfeeding and pediatric dentistry. I mean, you can definitely play an important role because what happens if the child is having a tongue tie, especially, okay, it is very, very difficult for the child to feed, okay, and it is very, very stressful for the mother also. So now this comes in your purview, okay. So this comes, you as a periodontist are entitled to do this. So if somebody asks, what is my role? See, this is the role and this is the scope. Then child psychology, you will have to learn a lot and a lot many things about child psychology, because to make a child sit on the chair, to make a child open his mouth and then allow you to actually perform it, it's very, very difficult. So you as a periodontist will be learning child psychology in detail. So based on your child psychology, you will be able to either adopt pharmacological behavior management techniques or non-pharmacological behavior management techniques. So all these things will definitely help. Then preventive orthodontics, you are the first guide. Okay, you're watching the child from birth, and if you see any anomalies or any, I mean, the child, for example, is having habits, thumb sucking, tongue thrusting, mouth breathing habits. So these habits have a very bad effect on the overall growth and development and positioning of the teeth and the jaws. So you as a periodontist can intercept at this stage and definitely be of great help. Oral myofunctional therapy. Okay, this is basically, what do you mean by orofacial myofunctional therapy? This is therapy used to correct the improper function of the orofacial complex, that is the tongue, lips, and jaw, soft palate, and larynx, and help to address retained poor health habits related to mouth breathing, improper chewing and swallowing, tongue try and thrust, nail and lip biting, thumb sucking, or pacifier use. So this is the Academy, and according to the Academy of Orofacial Myofunctional Therapy, these are the disorders of the muscles and functions of the face and mouth. So you as a periodontist can enter into this field also. Then management of trauma. Trauma is there everywhere, everywhere. And you as a periodontist see children are on the field, and trauma can occur right from birth till young age. Very, very common on the field. So you can be a trauma specialist, right? And a lot of things are there in the management of trauma, which doesn't come in the other branches. Then sedation. Now, as I mentioned earlier, you will be learning child psychology, but there are many times where your psychology and all your non-pharmacological behavior management techniques are not, or you are unable to manage the child, or there might be situations where the child is genuinely very uncooperative, or is so small that it is beyond the age of reasoning, that no matter how much you try to explain, for example, a 1-year-old child or a 2-year-old child, you are unable to manage. So in such situations, sedation and pharmacologic behavior management techniques are of great use. So you'll be learning that also. So sedation, you have the nitrous oxide oxygen. Friends, laughing gas. This is what the laughing gas is all about. And laughing gas, for your information, friends, was discovered and brought into this world by a dentist himself. So you'll be learning that also. And then as a part of the painless dentistry, lasers. Lasers has great use in pediatric dentistry. So you can be a laser specialist because laser makes the work fast. So you as a periodontist have full right to use this particular beautiful device. Soft tissue lasers, hard tissue lasers, all come. They can be used for frenectomies, tongue ties, pulpectomy, pulpotomies, removal. I mean, if the tooth is not erupting and there is, a thick layer of fibrous tissue over it, you can cut it very easily with the help of lasers. Now, again, I'm giving you a small circle where, and there is a various arena of research in pediatric dentistry. Research, there is always scope. I mean, I just forgot to mention painless dentistry. Painless to pain-free dentistry is one of the biggest field. How do you make dentistry painless and pain-free for the child? Various anesthesia devices are available, right from computer-aided anesthesia delivery system like the wand. You have something called as a dental wipe, vibrajet, star pen, and you name it. I mean, to make the injection pain-free, a lot of new devices have come and they have best use in pediatric dentistry. And coming back to research, there is a lot of scope research in the field of interceptive orthodontics, in the field of traumatology, pulp therapy. So many new materials are coming in, regenerative endodontics, okay, new radiological techniques, and then research related to special healthcare, children, sedation and hospital dentistry, and various things. So research, periodontics has got a lot of areas for research also. And now finally, it is concluded that the main aim of periodontics is prevention of disease because very effectively implemented in younger age groups. Okay, so you as a periodontist are laying down the foundation. Okay, So if the foundation is good, the structure is going to be very, very good. So you are the person who's going to introduce the child to the toothpaste, to the toothbrush. You're going to train the mother. Okay. And by doing this, you're going to train the whole family. So general and dental health of the child will be in your complete hands and you will be able to guide them very, very nicely. Now, a very small statement to end this whole lecture on, like a young child grows into a mature adult, pediatric dentistry has also matured from its infancy to a full-blown, well-recognized and respected specialty. Okay, lots and lot of scope is there. So now you have multiple reasons to choose pediatric dentistry as a career. And in this lecture, in short, I have explained to you the scope of periodontics and preventive dentistry. This can be asked as a full question, and you have a lot of things to write about it. Thank you so much.